welcome to another episode of Active Aging. I'm your host, Danielle Procopio, and we're very excited to have several of our physicians from Steward Health with us today to talk a little bit about what's been going on with COVID-19. So I want to thank each of you for joining us today. We know how busy your schedules must be, and for you to carve some time out was very nice. So thank you so much today. Before we get started, I do want to make sure that we introduce our physicians that are with us. So first of all, we have Dr. Munir Shah. Dr. Shah specializes in infectious disease, and he's been serving the Valley since 1995. In 2007, Dr. Shah joined Northeast Ohio Infectious Disease Associates and became an active faculty member with Western Reserve Health Education, a Steward teaching affiliate. You were appointed the program director of the WRHE Internal Medicine Residency Program in 2018. And Dr. Shah is also an associate professor of internal medicine at Northeast Ohio Medical University and sits on the board of directors for the Blue Foundation at Northeast Ohio Medical University in Rootstown. Dr. Shah is board certified in both internal medicine as well as infectious disease and is a firm believer in antibiotic stewardship with a passion in taking care of multi-drug resistant organisms. So thank you, Dr. Shah, for joining us today. So we've got Dr. Robert Moosally. He is a board certified physician in emergency medicine, and he serves as the chief of emergency department at Steward Regional Medical Center, as well as being the regional director of emergency medicine for Steward Healthcare. His special interests include provider wellness and engagement, process efficiency, evaluation and management, and integrated service line approaches to patient care. So thank you so much for being with us today as well. And finally, we have Dr. Sarah Mohman. Dr. Momen is a board certified physician in psychiatry. She is a full-time psychiatrist at Trumbull Regional Medical Center in the adult and geriatric behavioral health departments. Her clinical interests include child and adolescent psychiatry, ADHD management, psychotic disorders, and personality disorders. So Dr. Momen, thank you for joining us today. I'm sure that all three of you have very different perspectives on what has happened to our community during COVID-19. And I want to spend some time talking about exactly what you've seen and what's going on in the community. So tell me a little bit about what is your impression of how COVID-19 has impacted the community? Dr. Shah, I'll start with you if that's okay.
Sure. Yeah, look how the pandemic has spanned over the past 9-10 months. So it has not only just our community, but the whole world has been affected from this. But coming back to our community, we have a lot of geriatric population. And with the way this virus works, the way this virus spreads, the most important thing is social distancing and putting on the face mask. So with that, your social gathering is gone, your big events are stopped, and even a lot of workplaces are affected. And more so, the essential workers are affected because, not only they're the front line handling this patients, but they end up working so much overtime with this pandemic. But our community, our geriatric population, and actually everyone in our community has been significantly affected because they have to restrict their normal day-to-day activities and where they can go, what they can do, how they can interact with other people. So in a way, it can become a little depressing when you're not able to do your routine activities.
Sure, absolutely. And there is so much more to COVID than beyond just those initial respiratory symptoms that everyone was so focused on. And I'm glad that we're going to be able to talk a little bit about, what you all are seeing and how it's been affecting all of us, both physically as well as psychosocially. So I think that's an important part that we don't always talk about. I know the question that we are getting nonstop here at Shepherd when we're talking to our residents as well as their family members and community members is, when are things going to get back to normal? And I don't know if things ever will get back to normal, but in your opinions, when can we see things start to return a little bit back to what we expect?
Right now, first of all, going back to COVID-19, looks like in last 1 month, it has slowed down a little bit. Thanks to social distancing, wearing a face mask, and some immunization that has rolled out in the market has also helped. We are hoping by June, July, when majority of the Americans, at least 60-70% of US citizens are vaccinated, probably we'll see a significant decrease in number of cases of coronavirus infection. And the way these two vaccines which are rolled out right now has some protection against the newer strains or the variant strains of coronavirus. So by getting vaccination, definitely we will achieve some normalcy earlier. So I would strongly encourage people in a community to go ahead. If you have an opportunity to get the vaccine, get the vaccine. So we hopefully by this fall, we will see some normalcy in the community.
Yeah. And, you're talking about the vaccine, and I feel like every night when I turn the news on, that's one of the leading stories. We're talking about what's going on with the vaccine. So for those that are out there that might not have taken the time yet to talk with their physician, what can you tell us about the vaccine? So, I know why it's important, but how does it work, and what do we need to know about the vaccine?
So the vaccine is, basically we're giving you the medicine or in the form of vaccine, which helps to produce antibody. So anytime you have any kind of viral infection, your best defense to fight against that virus is to have antibodies. There is two ways you can produce antibodies: by having a natural infection or by getting a vaccine and basically telling your body to react as if there's an infection. So your immune system starts producing antibodies. So in future, if you ever get an infection, these antibodies will protect you from getting sicker. Now, getting vaccine does not mean you will never get an infection. You can still get an infection. Is that your symptoms will not be serious? Your symptoms will be very mild, or you might be asymptomatic, and the virus won't be able to replicate in your body. So you will have minimal symptoms. So the way the vaccine works is vaccine helps you to produce that antibodies without ever getting infected. The two vaccines that are in market right now, Pfizer and Moderna, both are produced by messenger RNA. It's a synthetic messenger RNA. So there is no live virus particle. But this messenger RNA helps to produce antibody against that spike protein, what we call. So in future, if you ever get infection, there should be full protection from this. So I strongly encourage everyone in the community, if you have an access to vaccination, please go ahead and get the vaccine.
Yeah. And when you're talking about how the vaccine works, where it's messenger RNA instead of a live infection, is there anything that we need to be concerned about? Is that a safe type of vaccination for us?
Yeah, when you produce a vaccine where there are no live particle or no live protein from the virus itself, usually those vaccines are very, very safe. Yes, you will always have some side effect from the injection itself. So a little bit of arm pain, little bit of fatigue, maybe malaise and a little feverish or chills for a day. But within 24, 48 hours, most of those symptoms are gone. Most of the patients that I talked to who got vaccine and some mild symptoms, within taking one or two Tylenol, within 24 hours, they started feeling normal. So I won't say that you'll never have any side effects from the vaccine. Yes, there are some mild side effects from the vaccine, but they're easily controlled, and it's much easier to control those mild symptoms than getting an infection itself.
Absolutely. And I know there's been some talk too about taking, those medications prior to being vaccinated. So people have said that they might take Tylenol or Advil prior to vaccination. And I know that we have been discouraged from doing that. So if I'm worried about side effects, should I wait until I get my vaccine to take my Tylenol, or should I take it ahead of time? Or does it make a difference at all?
It doesn't make a difference. It doesn't, because once you take any medicine, whether it's a Tylenol or Advil, within 1.5 to 2 hours, it gets absorbed in your body. So let's
Right.
say you took vaccine 8 o'clock in the morning, and by 3 or 4 p.m., if you're having some mild symptoms in the form of being a little feverish or malaise, and if you take Tylenol within an hour or two, you will have enough Tylenol in your system to negotiate those symptoms. So
Good.
it doesn't matter, but I know it gives you some placebo effect, some peace of mind by taking one Tylenol just about half an hour or 1 hour prior to vaccine. There is no absolute contraindication. So if that's what they like to do, I encourage them to do it, but it's not really shown to be any beneficial.
Right. And when we're talking about, getting vaccinated here in Ohio, the governor's done a great job of prioritizing certain populations and rolling that timeline out, and making sure that we are looking at, our older population. Healthcare workers got that access to that vaccine first. But as we're seeing it rolled out more and more, and it's available to the general population, who should get the vaccine? Like, what populations should make sure to get out there as soon as they can to get vaccinated? Are there any particular people that you're especially concerned about?
Yeah. I think the prioritize has been through the age, because the older you are, the weaker is your immune system, and you have multiple medical problems or comorbidities. So when the vaccines were rolled out, they initially wanted age above 80 plus, then above age. The next week they made it above 75 and plus. And now, as of now, I think it's age above 70 and plus. But anyone who has multiple medical problems in the form of uncontrolled diabetes, uncontrolled hypertension, or any other conditions where they're on a lot of medications or comorbidity, I think they should step forward, talk to their physicians, and try to get enrolled for the vaccination.
Okay. What about children? Are they currently recommending that children get vaccinated?
No, not really. At this stage, I think there's no recommendation for children to come forward and get vaccinated.
Okay. And if I want to get vaccinated, how do I go about registering for the vaccine? What would I do to get my hands on a vaccination?
I think every hospital has a hotline where you can call, and I'm sure the health department you can call. And the government is already working on having much more centers opened up where they can call and get vaccinated. But as of now, for Trumbull Memorial Hospital, the phone number is 877-358-8794. That's the line or designated just to call for the vaccination. Get yourself enrolled for the vaccine, and I'm sure they will put you in the portal, they say, or enroll you for the vaccine, and you should be able to get it.
Okay. And Dr. Shah, is Trumbull able to give vaccines to people who live outside of Trumbull County? So if I live in Mahoning County or Columbiana County, am I able to still come out to TMH to get my vaccine?
Yeah, I think when you get enrolled for vaccination, they're asking for your residential proof for where you live, your driver license. As long as you have Ohio license and Ohio residential address, I don't think it will be much problem getting vaccinated. I think cross state might be a problem. So if you're from Pennsylvania or from New York and trying to get vaccine here, might be some issues in enrollment. But if you're already having a residential address here in Ohio, I don't think it will be a problem. You don't have to be from the same county, but as long as you're from the same state, you should be okay.
Perfect. Very good. Thank you. So if you need to get vaccinated, please make sure that you call that number that Dr. Shah shared with us. They can get you registered and find a time for you to come in and get your vaccination. So I know that one of the questions we're hearing a lot in the community is, if I get sick or if something happens to me, what am I supposed to do? People have had a lot of concerns about seeing a doctor, going to the hospital. So what's been going on at the hospital? If I have an illness or if I have some type of injury, is it safe for me to come and see all of you? What alternatives should I look at, before coming to the hospital? So Dr. Moosally, if you have anything to tell us about that and let us know kind of what your take is on what should we do during illness or injury at this time.
I always tell folks that we're here for you. We're here to take care of your concerns, your illnesses. And so the answer to the question is, if you're sick and you feel like you need help, you need counseling, you need just resources, or you need actual intervention, you should not hesitate. You should not wait. We are here for you. And what that means is we've taken all the necessary precautions and beyond to protect you and your family members, not only while you're there in the hospital, but afterwards when you leave. We make every effort to assure that you're not taking anything with you once you go, and that we want the environment when you arrive to feel safe, to know you're safe and know that you're being taken care of. So people are asking me, should I wait until I'm really, really sick to come into the hospital? Is it dangerous for me to come there? And the answer is no. We would like to see you sooner rather than later. We're prepared to take care of you. We always have been. Even if you're just not sure, I tell folks all the time that we're just in case people. You should never feel bad about coming in for something that otherwise would have been minor. It's a scary time. Folks get symptoms of coronavirus infection, and they're not sure. They're worried that they're going to spiral down a very, very dangerous path. And then they get there and they're okay. And we explain to them why they're okay and what they need to do. And most cases, it's fairly simple things that they need to do to protect themselves throughout their illness, to assure that they're well nourished and well hydrated. Over-the-counter medications will work, and sometimes they feel badly that they quote unquote wasted our time. And I thought it's never a waste of time. I'd rather see you now than when you're really ill, and that's why we're here, is to give you that assurance in whatever treatment you may need.
Mhm. I know that there's been a lot of talk about telehealth since the beginning of COVID. We've seen a lot more physicians and organizations looking at telehealth as an option. Has that been something that you all have used at TMH at all? Have you looked into telehealth?
Sure, everybody's using telehealth now. One of your earlier questions was, how did you say it? You said, are we ever going to get back to normal? I think a new normal has been established because after this pandemic started rolling full steam, a lot of new resources came out. Things that were on the fringe have now become the main line, and telehealth is one of those things. Folks can use telehealth whenever they feel the need to just talk to somebody. If they have questions that they're not sure and they need an answer, rather than getting in their cars and going someplace. It's a great resource. However, as someone who's participated in telehealth in the past, I can tell you there's no substitute for an actual in-person visit. Talking to people, see you, they can hear you, they can feel your lymph nodes, listen to your lungs, listen to your heart, look in your eyes and throat and nose, and it makes a big difference. But if you're fairly confident that you're okay and you just have some questions and you have telehealth as an option, it is a good option, and you should consider it.
Great. So if I have some type of illness or injury, should I reach out to the hospital first before I come out, or should I just drive straight to the emergency room
Like I said,
and
we're
get
ready. We're prepared for all comers, and you do not wait. Do not pick up that phone and ask if you're sick enough to where you're considering going to the emergency department. Um, you've already made that decision in my mind. Get to us, and we'll help you work through it. And develop a path or a plan, afterwards. But if you if you're uncertain and you're not feeling well, and you've even considered it, yeah, you should make that jump. That's why we're there, and it's safe for you.
Perfect. Speaking of safety, we've had dozens of residents that have come through Trumbull Memorial since the start of the pandemic. I'd like to thank all of you for your hard work. On our end, we've been very impressed with the care that they've been given. It's just top notch as always. A lot of them were very concerned about going into the hospital, and they've all come back with, praise, nothing but praise for your staff and for the environmental conditions of the hospital. So I can only imagine what's going on behind the scenes in order to ensure patient safety. Are there any precautions that you want to share with us and let the community know that TMH has taken in order to really make sure that when patients are coming in, they're going to stay safe?
Sure. I mean, just when you first walk in, you'll notice that there's hand sanitizing stations everywhere. There's mask requirements. Back in the emergency department and throughout the hospital are already stringent cleaning policies have been stepped up several fold. Rooms are scoured after patients leave. If a patient has COVID, we try to keep them in certain rooms in certain areas. We try to eliminate interaction amongst patients who have COVID and those who don't. And not only have COVID, but just symptoms. And our symptom list is a very broad list. It encompasses a lot of things just to be safe. We cast a large net to make sure that we don't miss anything. And we'll usher those patients to a certain area and other patients to another. You're not going to come in with an ankle sprain and share an adjacent room with somebody who is coughing with a fever and short of breath. And so aside from that, the nursing staff and the unit clerks and our transporters, our environmental staff work tirelessly throughout the day, 24 hours a day, to make sure that every inch of that facility is clean.
Yeah. And I really want to applaud all of you for taking care of all of that, because I know what we're doing on a much smaller scale here at Shepherd. And so when you think about the monumental task of having to keep a hospital clean and, keep everybody safe, it's really a time for us to appreciate everything that goes into that on behalf of all of you. So, great job and keep up the good work. And,
And I'd like to say the environmental services staff are the unsung heroes of this
absolutely.
pandemic, in the hospital system. Without them, the work that they do, without them, it wouldn't be as safe as it is.
Right.
They deserve praise for that.
Absolutely. So I know another thing that comes up a lot for all of us as healthcare providers is visitation. So if I'm coming in with something and unfortunately I do need to be admitted to the hospital, am I allowed to have visitors while I'm there?
Well, all I do is ask Dr. Shaw. If he says it's okay, no. So we are following the state and state and local guidelines for visitation. We went through a long period where we were not allowing visitors for their own safety, and that was tough, especially when you have somebody who's sick and not doing well. But it was for everybody else's protection. We are now allowing visitors. It's very closely monitored and regulated. But yes, we are allowing visitors at this point.
Great. And I'm sure that gives people coming in a lot of peace of mind to know that their loved ones are able to come and see them as long as they're symptom free and they're not running a fever and they get past the screening at the front door. So that has to give a lot of sick people some great peace of mind. So I'm glad to hear we've turned that corner. How about scheduled surgeries? I know initially in the pandemic we were delaying non-urgent pre-scheduled surgeries. What's going on with scheduled surgeries at TMH right now?
Scheduled surgeries are going on as planned. All of our patients who are undergoing procedures, elective procedures, are getting tested before they go into the operating suite for their own protection, for the protection of the staff. Um, Again, same very stringent guidelines are followed. So elective procedures are going on and will continue to do so.
Great. Speaking of COVID testing, if I need to get a test, am I able to come to the hospital to get a test?
You can. So folks can get tested without necessarily going through the emergency department. We've set up an auxiliary trailer outside of our department. Sorry, outside of our
That's
department
okay.
to edit that to have patients tested as an outpatient. It's one directional, so you come in one door, go out the other. The staff in there keeps the facility or keeps the area clean. It's you stay in your car until you're called in, and then it's one at a time that goes through. Yes. And there's several facilities that Stewart has set up around the community to do that.
Perfect. Perfect. It's one-stop shopping. If I think I have COVID, I can come in. If I break my leg, I can come in.
Yeah.
So you guys are doing a great job, and I appreciate making sure the community has access to those critical services all the time, but especially right now during these uncharted waters. So keep up the great work. We've talked a lot about what's happening physically with our patients, those that are affected by COVID, but we haven't spent very much time or energy looking at the psychosocial side of that. So I wanted to take a few minutes to talk with Dr. Momen to talk about the emotional and psychosocial effects that she is seeing and that the hospital is seeing as a result of COVID-19. So what is going on with your patients, both, mentally and emotionally?
So we've seen, of course, increased rates of depression, anxiety, substance abuse, suicide, even this last year. And it makes sense because we've all had to go through so many significant changes, having to adapt to all these unknowns. It's been a very difficult year, especially with people that already have pre-existing mental illnesses. It's a very difficult, vulnerable time for them. And I mean, we've had patients have had to deal with limited social support, isolation, financial issues, job loss, health anxiety, political climates. I mean, there's just so many things going on this year. And like I said, if you already have a mental illness, it's even harder exponentially. So, my biggest recommendation is if you already have a pre-existing mental disorder, you need to keep following up with your treatments. All those resources are still available. Even if it's virtually, you're a psychiatrist for your medications, your therapist, your case managers, your counseling, your substance abuse treatment. It's so important to keep doing all of those things because everyone is still there to help.
Absolutely. And I think that when we talk about unsung heroes in the pandemic, I think the mental health community mobilized more quickly than I think most of us could have imagined. Because when you think of all of those people that are somehow affected and on medications or need access to counseling, it was very impressive on our end as we were working with providers to see how quickly everyone mobilized to make sure there wasn't going to be an interruption in service for anyone that was affected. And so, that was remarkable in my opinion. It was just really remarkable to see.
Right. And, if you're in some kind of an emergency situation, which that's, if you're suicidal, if you're paranoid, you're psychotic, you're thinking about suicide, you're using a lot of drugs and alcohol, and you think that you're in danger, you still need to come to the ER to get evaluated. Here at Trumbull, we have a 35-bed unit between the adult and geriatric sides, and we're still there. You know, we take all the precautions, like going back to the ED procedures. We're having 2 COVID tests done before we bring patients in, the PCR test and the rapid test. So we're taking all the precautions before we bring patients into our units. We're capable of handling a multitude of mental illnesses, and our goal is acute stability. And we're still here, and the resources are still available.
Great. Are you seeing a lot of new diagnoses of depression? Is there a lot of new clients and patients you've treated for different disorders?
Yeah, there's been an increased rate overall in depression and anxiety. Even patients that didn't have depression, anxiety before, right now with all these changes, it's popping up here. And it's just been so many changes for people, the lack of routine, even some people are laid off, they're sitting at home. There's just so many things contributing to this mental illness during this pandemic.
Absolutely. And one of my favorite statistics to talk about on the show, and we've probably mentioned this in at least a dozen episodes to date, is that, there was research that came out that said that isolation can be just as damaging for an older adult as smoking a pack of cigarette each day. And so when you think about that and you think about it inside the confines of COVID, we're telling our older adults, you can't leave your house, you have to stay home, you can't interact, you have to keep that, that group that you're interacting with very, very small. It's only natural to expect those increased levels of depression and an increase in some of the mental disorders that we've talked about. So what are some things that we can do at home to prevent depression and to decrease isolation and make ourselves feel better at this time?
So like you said, we as humans, we need social interactions for our own well-being, to find a sense of purpose. So when that's taken away, especially for elderly patients, it's really tough. Now, there are things you can do at home, and they all kind of go back to number one, self-care, still taking the effort to care for yourself every day. Even if you're spending all day at home, it's still important to get up, maintain your routine, take care of yourself, eat healthy, go outside and get physical activity, 30 minutes a day at least. Even when it's winter and cold, or exercise at home, or just go outside for a couple of minutes. That really does help. Still keep in touch with family and friends virtually. Don't isolate, reach out if you need help, talk to your therapists, counselors. Like I said, those people are still there. And it also helps to maybe do something that gives you purpose. A lot of people in the pandemic have found different projects, activities, different interests, and to bring some of that back to give us that purpose and joy back, that's important to keep us going.
Absolutely. Absolutely. And it's, as we're thinking about this, even if we're putting some of those pieces into place, and I'm still struggling, at what time or what signs should I look for a loved one, or I myself think about introspectively, at what time do I need to seek immediate help? Like, what should I be looking for or thinking about to know it's time to give you a call?
Yeah, so just really looking at functionality. If you're not able to function with your day-to-day activities, like can't go to work, you can't get up, you're not eating, if you're not taking care of yourself, that's a telltale sign of depression. If you're having any suicidal thoughts of hurting others, if you're hallucinating, if you're drinking more alcohol, you're thinking about dying, those are emergencies. And you need to come to the ER to get evaluated, get admitted to our unit, and just take those.
Well, I'm so grateful that all three of you were able to take the time with me today to talk to our community a little bit more about what's going on and how to stay safe. And if necessary, come into the hospital and know that it's going to be okay. So thank you so much. We appreciate your time, and we appreciate everything that you're doing for our community.